Hi, Dr. John Robinson here, longevity medicine expert, author, speaker, and entrepreneur and doctor. You've likely heard about semaglutide and tirzepatide, the weight loss injections that are taking the country by storm. I want to actually explain what they are and how to use these powerful medications correctly. Commonly, you hear them referred to as GLP-1 agonists. But what does that mean? GLP-1 stands for glucagon-like peptide 1, and it's a peptide hormone found in the digestive tract. It stimulates insulin secretion, slows stomach emptying, which keeps you feeling full, and helps with the growth of pancreatic cells that secrete insulin. It benefits the heart, the nerves, it decreases inflammation, and it even helps with learning and memory, reward behavior, and how food tastes. But this is the actual hormone in question, and this is not what these medications are. They're very similar in shape to the GLP-1 hormone, but are technically a little different. Semaglutide, or Ozempic, is a GLP-1 agonist, which means it stimulates the cell receptor that usually responds to the real GLP-1 hormone, and thereby produces the same result as the actual hormone. Tirzepatide, or Mounjaro, this is a little different in that it stimulates the GLP-1 receptor, just like semaglutide, but also stimulates a similar hormone receptor for GIP, or glucose-dependent insulinotropic peptide. GIP also stimulates the growth of pancreatic insulin cells and many of the same things as GLP-1, but has even been associated with improving bone growth. So we call tirzepatide a dual-action medication, and many patients will even get better results on tirzepatide. Of course, both semaglutide and tirzepatide work extremely well when they're used correctly, but with most medications, there can be side effects. Nausea, gastric upset, these are very real for many patients. If you have a history of gastroparesis or intestinal blockage, a history of pancreatitis, inflammatory bowel disease, or a history of medullary thyroid cancer, or something called multiple endocrine neoplasia, or MEN, then you need to avoid these medications completely. And if you're pregnant, you would of course not use these either. But outside of that, they can be very helpful for many, many people with very good tolerance and very, very quick positive effects for fat loss and blood sugar control, exactly what we're looking for. But why are these medications working so well for so many people? One of the main reasons, and I've been discussing this concept now for over 3 years since first prescribing them, is that many people struggle with their weight because they're actually pre-diabetic and they just don't know it. They are what's called insulin resistant, and this leads to poor blood sugar control, fat gain, elevated cholesterol, but not bad enough to be diagnosed completely with diabetes. Once patients like this start using these medications, it solves the pre-diabetic condition. It controls the blood sugar, it improves the metabolism, and ultimately leads to fat loss. I have personally prescribed this medication to hundreds of patients at this point, and our whole physician group, thousands of patients. It works, but here's one of the other risks with taking these medications: muscle loss. The main reason is that patients simply do not get enough protein while they're on the medication, and this leads to muscle loss. Our patients rarely see this because we accurately measure muscle with our advanced scales throughout the course of treatment, but we also counsel on the exact amount of protein you need to maintain your muscle. Additionally, our comprehensive approach usually includes hormone balancing, which is vital to help with muscle maintenance and building, especially as we age. That's what you want and need when considering these types of medications: a comprehensive approach. Beware of the online source or the doctor who isn't going to follow you closely. Seek out comprehensive care. Please contact us and we will provide you with the best possible medical solutions for your fat loss goals.